As part of my role as Chief Medical Officer, I provide clinical governance to all the global businesses and also work very closely with the United Health Group Brazil. So the teams, our clinical care management teams of medical directors and nurse care managers are actually in the front line using these guidelines. We use MCG, the inpatient and surgical care product, the recovery facility care product. I think those would be the two major ones that we use, and of course the general recovery guidelines as well. Our users clearly are at different levels of proficiency. And it's interesting that regardless of the level of proficiency at which they're at, I think they all speak to the easy access of information required to support efficient management of cases. One of the challenges that we face, as you can understand in the global environment, is challenges around translating the guidelines into different languages. And it was interesting when we moved into Brazil with United Health Group Brazil, we thought that that would be potentially an insurmountable barrier. As you're aware, the primary language is Portuguese, spoken in Brazil. But it's interesting that what we found out is that the language of medicine, in effect, does supersede some of the barriers that we perceive, some of the cultural barriers, sociocultural barriers. And so we found that it certainly was a challenge leveraging the guidelines in Brazil, but once we socialized them appropriately and coached around those, they've been very well received, even by physicians whose primary language is not English. But I think it's important for me to continue to recognize and appreciate the relationship that we have with MCG, both on an individual professional standpoint and on behalf of my team. So thank you very much.